Hi, I'm Daisy. Welcome to our revision video.
Hi, I'm Rhianna. Our video is about lungs and gas exchange. I'm Kate. Our video is aimed at Year 1 students.
Hey, I'm Emma. We hope you find this video valuable.
The airways are split into two different sections, the conducting zone and the respiratory zone. The conducting zone is most of the respiratory tract and is made up of the nose through to the bronchial tree. This region's function is to conduct, clean, warm and moisten the air. The respiratory zone includes the bronchioles, alveolar ducts and alveoli and is the site of gas exchange. This diagram demonstrates the structure of the lungs. As you can see, the left and right bronchi come off the trachea. The bronchi then splits into bronchioles, which further splits into alveolar ducts and alveoli. The bronchi have relatively large lumens that are lined with cilia-covered epithelium to help move dust and other small particles. There is also a smooth muscle layer that contains mucus glands. Hyaline cartilage is also present in the bronchi in C-shaped rings to keep the airway open and allow some flexibility. The bronchioles branch off the main bronchi and have a much smaller diameter. They lack cartilaginous support and have a high proportion of smooth muscles in their walls.
This is a diagram of an alveolus, which is the site of gas exchange. We have about 480 million alveoli in our lungs to give a large surface area. They have one layer of squamous epithelium to reduce the diffusion distance for oxygen and carbon dioxide. The walls are also moist, which allows the gases to dissolve.
There are two pleural membranes which line the lungs. One is attached to the lungs and the other is attached to the ribcage. This causes the lungs and ribcage to not separate when expanding. The pleural cavity between the two membranes is filled with secretions, allowing free expansion and collapse of the lungs. The secretions also allow the two pleural membranes to slide over each other.
This is an oxygen dissociation curve. Hemoglobin has 4 subunits, each of which combine to an oxygen molecule. As the first one binds, it changes the conformation, making it easier for the next one to bind. At high partial pressures of oxygen, hemoglobin has a high affinity for oxygen, meaning it binds oxygen easily and saturates. When blood reaches low oxygen conditions, oxygen offloads into the blood and is replaced with carbon dioxide. The tissue is now supplied with oxygen and removed of excess CO2. For the next few minutes, we're going to follow the life of Rhianna and watch how her respiratory health changes throughout her life.
She is 14 years old and has been recently diagnosed with asthma. Asthma causes the airways to get narrower due to the release of inflammatory mediators such as histamine, constricting the bronchi. This causes symptoms like coughing, wheezing and breathlessness.
There is an increase in mucus production and the smooth muscle contracts. There is a decrease in FEV1. This is the forced expiratory volume in 1 second. Rhianna's forced vital capacity is unaltered. This is the amount of air she can forcefully exhale.
Triggers of asthma can be atopic or non-atopic. Inhaled allergens is an example of an atopic trigger, whilst non-atopic triggers include respiratory infections, cold air, stress or exercise. Salbutamol is a bronchodilator used in inhalers and is a short-acting beta-2 adrenoreceptor agonist. Salbutamol stimulates beta-2 adrenoreceptors, causing the smooth muscles around the bronchioles to relax, which widens the airways. This allows air to pass through more easily.
Rhianna is now an adult and has taken up smoking. This causes her lung epithelial cells to become inflamed and damaged. The chronic inflammation caused by chemical irritants in cigarettes can lead to obstructive pulmonary diseases, such as COPD.
Inflammation causes the airways to narrow and increases mucus secretion. It causes the alveolar walls to break down, leading to a decrease in respiratory zone volume. Exercise may become difficult as the lung tissue cannot cope with the increased demand for oxygen.
Rhianna is aiming to improve her health by exercising and has started playing sport. However, she smokes and has asthma. She experiences difficulties in breathing and needs to catch her breath often.
Come in. Hi. Hi there, welcome. I'm Senior Dr. Campbell. How can I help you today? Hi Dr. Campbell, I'm really worried. I've had 3 lung infections in the past year. I'm coughing and wheezing all the time and I've got a lot of mucus build up. I've also lost a lot of weight recently. Okay, I don't want to worry you, Rhianna. These are all symptoms of a lung disease called emphysema. Emphysema is a destruction of the alveolar walls. I want to do a spirometer test on you to measure the volume of air inspired and expired from your lungs. Is that alright? Okay, breathe as hard as you can into this, please. I'm sorry to say, but this test concludes you do in fact have emphysema, which is an obstructive lung disease. As your FEV1 value that I just mentioned is only 60% of your forced vital capacity. It should be around 80%. What does this mean? Is it curable? I'm really sorry to say that there's no actual cure for it, only methods to try and treat your symptoms, such as quitting smoking. I can prescribe you some drugs, but I can see you've already got quite high blood pressure, so we might want to review this. Let's have a chat about it all.
After talking to her doctor and finding out more information about her disease, Rhianna is coming to terms with her diagnosis.
In emphysema, airway compression is exaggerated due to a loss of elastin, which causes the breakdown of alveolar walls. During forced expiration, the airways are less able to resist the collapse, which leads to a reduction in the respiratory zone volume and so reduced lung function.
Here are the key points we've covered today.
The airways consist of two sections. The conducting zone primes the air for gas exchange in the respiratory zone. The respiratory zone is predominantly made up of bronchioles and alveoli.
Asthma is an inflammatory disease which can be caused by atopic and non-atopic triggers. There is a decrease in FEV1. Common treatments include bronchodilators and inhalers.
Emphysema is an obstructive lung disease. It causes a decrease in FEV1 because of the loss in elastin and exaggerated airway compression. It is incurable, but treatments include corticosteroids to decrease inflammation.
Thank you for watching this revision guide. We hope you found this helpful in aiding your studies.